It's 10:43. Good morning and welcome back. The images, the videos, and the news from the Middle East as the Israel-Hamas war continues, it can really take a toll on your mental health in one way or another, whether that's directly or even indirectly. We are sitting down live this morning with Dr. Imran Ali, who is highlighting how PTSD doesn't just impact those who are living the trauma, but also those who are witnessing it. And of course, our hearts, go out to viewers, anyone who may have family, loved ones in Israel. This could be a bit of a triggering topic of discussion, so we do, of course, want to start by saying that.
Yeah, absolutely. And I think this time, the images have been really searing, really graphic. And, a lot of my patients who are looking at the news, they're actually been affected by it. I take care of a lot of patients from all kinds of nationalities. And, being exposed to such wall-to-wall coverage, has been shown in studies to trigger some forms of PTSD. And PTSD is officially, diagnosed after an individual has experienced an actual event that's, violent, or even the threat of violence in the past.
Right.
And it's marked by nightmares and, anything can trigger a flashback to that original event, and it can cause severe anxiety, insomnia. And now with social media, these images are everywhere. And I'm getting a lot of questions from my patients and their loved ones, and especially kids who are being exposed to this. Elementary school kids who are exposed to this on social media. They don't have the insight to put this in the greater picture. So it seems so real that they almost feel afraid that it's going to happen to them. And I think it's important and it's very important to limit your exposure to the news, especially at nighttime, because right before we go to sleep, if we take in all these images during sleep, during REM sleep, that's when all these images get consolidated. And studies show that can actually exacerbate any underlying anxiety, because once we consolidate these images, in the part of the brain called the amygdala is our fear complex. So it actually, being exposed to all this can actually affect our brain chemistry.
I mean, you mentioned that it's difficult for children to process. As adults, it's difficult to understand and process what is happening in the Middle East. It's just devastating what we are seeing. We know that Americans have been killed as well. And you mentioned that people should limit their exposure to the news. My question for you is, if people feel that they need to stay up to date, if they have loved ones impacted and they want to continue following the coverage, but they find themselves in a state of panic or a really anxious moment, what could someone do to calm themselves down, to get their mind back in a healthy, good place?
Well, I think you need to rely on loved ones. You need to process what you're feeling, and it is important to stay in touch. A lot of people are telling me that they feel helpless, because there is a sense of helplessness. There's so much unknown. I'm taking care of patients at a Jewish nursing home, so a lot of them are actually very, they're triggered by the events. I'm taking care of Holocaust survivors. So it's very, very challenging. I think it's important to stay in touch, use print media. Don't, go to social media. I think social media, as journalists, we have a duty to, tell viewers the following images may be disturbing.
We do.
We also pixelate and censor some things. But on social media, I have seen, really graphic images, which I think people don't need to be exposed to that, frankly.
You're right. Dr. Ali, I think this was a very timely conversation. I hope that it helped a lot of people who may be feeling a certain way right now. I think we can all agree no one feels good about what's happening, and it's difficult.
And I want to stress that people shouldn't turn to alcohol or other self-medication. If you really are feeling distress, seek help, really.
And don't be afraid to do so. Good conversation. Thank you for your time, and thank you for your insight. We'll be back after this.